consult a doctor first, and then if he suggests you a health checkup, yes, go for a health checkup, and according to that value you can revisit the doctor. When I mentioned cancers, for example, some cancers just run in the family. For like example, some gastrointestinal cancers can run in the family. In such conditions, in particular, if you are having such histories in your family, then you will have to go for a cancer screening test. Hello everyone, I am Dr. Ashwathi Soman. Right now, you just asked me about basic health test. See, the basic health test depends on the person with symptoms. That is, if a person is healthy and he is around say 22 years, he doesn't need any test for his daily routine activities. But if he is above 45, usually we ask a person to do test when he is above 45 years of age. Every year, yeah, he can do some basic health test. But if his age group is between 35 to 45 years of age, and if the previous tests are normal, then there is no need to do a test very frequently. But yes, he can repeat a test after 2 to 3 years or 3 to 4 years, depending on what change that he is expecting to see in his blood test. See, if the person is around 35 years of age and if there is any change in his previous test or in the test that he already had taken, then yes, you have to do a repeat test according to the change that has happened in the test, that is within a 6 months period. So when we talk about the basic health test, you can actually go for a complete blood count, then ESR, or if you are having some fever, then the doctor may suggest a CRP, then lipid profile, LFT, that is a liver function test. Lipid profile curtails to your cholesterol levels in your blood, and yes, in the lipid profile you have to do that test in the fasting mode, and that will be checking your say total cholesterol, LDL, HDL, triglycerides, VLDL, etc, etc. And then you can go for an LFT, liver functioning test, or a renal functioning test, and you can just do a basic urine routine test and the blood routine test. In the blood routine test, yes, you can see what is your level of hemoglobin, WBC, RBCs, etc. Now, each test can give you different opinions, not opinions, different results actually. See, but that doesn't mean, see, if you are taking a test from a laboratory and the blood test reports or results are coming within a prescribed normal range, we tend to think that that is normal. But no. It depends on the age and the factors why you did that test on the first time. For example, if your hemoglobin may be just everything is normal and the hemoglobin is just below the normal range, and we might think that yes, it's just below the normal range and it's okay. But then you might be suffering a very lethargy, or you'll be very tired in a day. Yes, then yes, it should be corrected. It should be corrected to the normal range. But in some cases, for example, if you're doing a thyroid test, the normal range we say about 0.5 to 5, but in case of pregnancies, the normal range actually comes down to below 2.5. That is where you need the thyroid hormones to be. So just doing a test all by yourself without consulting a doctor and just thinking that it is in a normal range, it's a foolish to believe. You have to consult a doctor after doing a test. The same goes with the cholesterol. In the cholesterol levels, there is LDL, HDL, as I said, there are various ranges of cholesterol that you can see. In those cases, if for example, if your value is about 130, that is in the normal range, in the usual addicting. But if you are a diabetic person, we tend to have that we need to keep that level of cholesterol below 100. So in such cases, it's definitely necessary to consult a doctor. Now, coming to what is a blood pressure, other than the blood test, if you consult a doctor, if for a general health checkup with a doctor is a good fine thing, because in that condition you can actually assess a person just by looking at that person, or just how he is walking into your OPD, etc. For example, if you are having pallor, that is if your HB, hemoglobin, is in a very low state, you may manifest some situations like you will be very pale to look at, and you will be lethargic, you will be tired, and that can just be made out from just by looking at your face. The same way, if you are having some diseases like jaundice, then your scleras, the white part of your eye may be in an yellowish discoloration might be there, or there may be some freckles on your face, or xanthelasmas on your face, or some skin tags on the visible part of your body, etc, etc. So depends on like what your symptoms are, you need to go for the health checkup. Consult the doctor first, and then if he suggests you a health checkup, yes, go go for a health checkup, and according to that value you can revisit the doctor, or you can just do the test in a 6 months period or a 6 weeks period, depending on which test is not in the normal limits. And then if it is normal limit and your age is around 22-30, then you might not need it to do it every year, every single year. You can do it in 2 to 3 years or so. But if you are above 45 years of age, we usually ask them to do every 1 year or 2 years. It's mainly because it's always easy to diagnose a disease very early in your stage than to wait it to manifest it completely. But in many cases we know that even in diabetes, even type 2 diabetes is presenting to younger people. Even 22 years of age people are getting type 2 diabetes. So that comes to another issue, whether how to know if you need a health checkup. The normal daily routine a person should follow is that you should not have any addictions. The first and foremost thing, for example, smoking or pan chewing, etc., alcoholism, etc. So don't go for such things. Have a healthy diet habit. Healthy diet habit consists of 3 main meals and 3 to 4 short meals in a day. That is, every 3 to 4 hours you are having something to, just to satisfy your appetite. And don't have a lot of meals, lot of fatty foods, lot of fried items, etc. should be avoided. Even carbonated drinks should be avoided. That's a normal routine. And then one of the major important thing that you should have in your daily routine is exercise. You should have at least a 45 minutes of exercise per day in your routine. That is for 45 minutes of exercise for 6 days of a week. That is what we are expecting from you. That is the normal routine. That is the normal routine that a healthy person should follow. For if you are having a desk job and you are sitting for continuously long time, you can just count your steps and you know that you are not having the daily limit of 6,000 or 7,000 steps a day. You might be walking for about hardly 1,000 steps a day, and yes, that is actually not good for your body. You have to keep on moving, you have to be active, you have to have your normal diet, you have to have a normal sleep. Even stress or any other factors, having any diseases, any stress, any fever, etc., actually doesn't do anything good for your health. So in such conditions, if you are not having, that is a normal daily routine a person should follow. If you are not doing that, yes, then you have to think about what your current status is. That is one of the measuring factors is BMI. One of the factors to think about in such a condition is BMI. In body mass index, body mass index is roughly calculated by dividing your weight in kilograms by your height in meter square. But in a very rough pattern, you can say that if you are 160 centimeters of height, if you are having 160 centimeters of height, then your ideal weight should be around 60 kilograms. That is the BMI. But there are a lot of ranges for a BMI. It should be below 25. For example, some persons may be above 25, above 30, 35, 40. It's a very huge BMI ratio of the body mass index that you are having, and that actually, yes, my friend, it is going to, it's going to affect your health in a very bad way. So just calculate your BMI and know whether you are in the healthy category or not. If you are in the healthy category, all is well and fine. Then you have to look for any genetic diseases which is happening in your family. For example, if there is any younger age, if your uncle, maternal uncle, paternal uncle, or anybody, if your uncle or your parents did have some diseases, for example, it could be a thyroid disease, it could be some kind of cancers, it could be a heart attack, it could be diabetes, etc. Any such diseases, if they have manifested that in an younger age, for example, usually we say that the problems come up by the age of around 45, but sometimes they might have had an experience of such things when they are very young age, say 20-22 years of age. Then yes, you have to have that history in your mind, and then you have to know what to test and when to test. You have to be careful about such diseases can run in the family, and you might have such diseases. When I mention cancers, for example, some cancers just run in the family. For like example, some gastrointestinal cancers can run in the family. In such conditions, in particular, if you are having such histories in your family, in your very close relatives, not in a very far relatives, yes, in your very close relatives, if you are having such kind of a history, then you will have to go for a cancer screening test. Maybe you might not have any symptoms yet, but it is always better to go very early for a proctoscopy or for an endoscopy, wherever, depending on where your cancer have manifested or what sort of cancer you are having. Depending on that, you have to do a screening test. If the same is applicable for ladies with breast cancers also, breast cancers or cervical cancers. Breast cancers, yes, you can actually do a self breast examination and find out if there is any mass lesions in your breast. If you have found out any mass lesions, you just have to get a mammogram, you have to consult a doctor, you have to find out what that is. The earlier, sometimes what happens is that you found out a mass lesion and it is a benign lesion, then you might just leave it out, and then a similar lesion might appear and you might think that is benign. So please don't go for that, such a mistake. Any lesions anywhere in your body, any problems you have found out, you have to consult a doctor. Maybe you might think this is similar to the previous case what you have seen, but yes, you have to change that attitude and you have to consult a doctor and you have to find out what is wrong with that lesion. The same goes with the moles, freckles, etc. on your body. It might, in some cases, it might just drastically increase in number, increase in size, changes in color. There might be hair growth on that. So depending on if there is I'm not telling that if there is just change in one mole or one point, you have to go and consult a doctor. But if there is a big change, a visible change that is happening, yes, you have to consult a doctor. And if there is a sudden weight loss, if you are having a cough for a longer time, if you are having recurrent same infections, for example, it might be a simple mild fever, but yes, if you are having that as a recurrent episodes like 3 to 4 times a month or 2 to 3 times a month, if you are having that for such 3 times for a 3-month period, yes, then you have to consult a doctor. Then for females, if there is any menstrual irregularities, not just one irregularities, no, not like that, but if you are having a recurrent irregularity of heavy bleeding for more than 10 days, or if you're having recurrent bleeding, say you are getting your menstruation 2 times a month, or if the same problem is persisting, if you are having a severe dysmenorrhea for the 3 months and a continuous time period, or 3 menstrual cycles, you are having a similar problem, yes, then you have to consult a doctor.